Hi, my name's Paul Todd. I'm the Environmental Health Officer for the Shire of Ngaanyatjarra, which is the lands that you can see behind us. My role here at this moment is to try and introduce an environmental health training program, which is basically to introduce Indigenous young people into environmental health and work in the lands to increase the environmental health and educate themselves to a level where they can go on to greater and better things.
I operate a small private training organisation, Empower Education, and I'm based in Perth, and I mainly deliver environmental health training in the Midwestern Goldfields. But I've been asked by NG Health and NG Shire to come out here and deliver some environmental health training to the groups in the lands. And
the training activities include the reducing of the risk of diseases by injury or organisms.
And this trip we've been doing some plumbing and sewage, a little bit of pest control, and really enjoying a new experience, new country, new challenges, and it's been a lot of fun. Basic operation of a tap. So if you just have a look at that tap you've got there, you can see where the section's been cut away, and you can sort of have a look at that casting. You see there's a section at the base here, which is connected directly to the water supply, and the top section of that casting, if you take the spindle out of it, you can see the top section of the casting is actually feeds into the outlet of the tap. One of the goals of the workshops over the next 4 or 5 workshops and some field visits is my role is principally to get the guys through the Certificate 2 in Indigenous Environmental Health. So hopefully by July, those trainees who stay with us will have completed Certificate 2 in Indigenous Environmental Health. And through that, apart from the actual qualification, we hope to give them a whole range of skills and knowledge, allow them to apply environmental health intervention into the community. So a bit of basic pest control, a bit of basic plumbing, a bit of basic sewage and dog health and rubbish control, and health promotion to the broader community and to the schools as well. And through those techniques and those interventions, hopefully we can improve the health status of the Aboriginal people in the communities out here. Environmental health has a significant impact on health, and by improving the environmental health in the communities, we will hopefully improve the actual health status of the population of the lands.
To increase the young Indigenous workers' skills so they can go out and become tutors and mentors within their own communities and environments.
Alright, what we're going to do now, guys, is a bit of an exercise to show how germs transfer from one person to the next and how easy that's done. And it's pretty hard to see in a normal situation because germs are so small and we can't see them. Our hands are covered with germs, but we can't see them without some special equipment. So what we can do is cheat a little bit, and we can get this little plastic football and we can cover it with this special cream and give them a bit of a rub around. And then we can pass it from one person to the next person. So there we go, cream, catch, and throw it to another person and spread it around. Throw it around the guys, over this way, and over to Terry over the back there, and around here, and I'll take a bit as well. Then what we're going to have to do now is turn out the lights, and once we turn out the lights we can turn on this special little portable UV light, and UV light is similar to what you see in discos, the black lights you have in discos, and what that UV light will show up where that cream is on your hands. So we're trying to simulate what happens to germs. So if your hands are really dirty and you've been cleaning some sewage and haven't washed your hands and you go home and you muck around with your kids, maybe you've got germs on your hand, and you think you're doing the right thing, having a bit of play with the kids, but what you've done is actually transfer those germs and that sewage to your kids. So hopefully when we turn the lights out in a second, we should be able to see this cream showing up in our hands. So you can see on Conway's hands there where we've got quite a lot of that gel. The gel we put on the football is showing up. You can see his normal skin is not showing up because there's no gel on what we're trying to simulate as germs, but in his hand, which has been mucking around that contained sewage, there's germs all over his hand. And even my hand as well, they were rubbed a bit off when I went and pulled the blinds down. You can see on my hand there. So in the fingers there, I had a bit of a wipe, get rid of some of it when I pulled the blinds down. You can see the inside of my fingers where I didn't wipe very well. And probably on the other side, my fingernail, see the fingernail there, I didn't wash my hands really well. And probably this side as well, I was a bit sloppy when I washed my hands. Here's another fellow here, there you go. See the germs on his hand. And this guy probably didn't catch the football well enough, but he's and very easy to transfer to humans. And particularly in my case, where I wash my hands, but I didn't do much of a job of it. So, you know, just giving your hand a bit of a splash is not really doing the job because you're missing your fingernails in between the joints there. So when you do wash your hands, you've got to do a really decent job at it. Otherwise, you're only getting halfway there. So I think that's enough for the classroom. We might go out and do a bit of practical work. What do you think, guys? Get out of here.
And if we can, our health workers can get into the houses and speak to the community, speak to the schools in simple terms and possibly in their own language, we can eliminate a lot of bad health and introduce some good health and prevent a lot of suffering within the community.
My name's Brett Cowling, the manager of the health service, yeah, behind me is some environmental health training that's been happening for a couple of days and part of a much broader strategy to improve environmental health of the Warburton community and of the Ngaanyatjarra lands. Environmental health is critical to moving a lot of disease prevention forward. Many diseases at the heart are caused by poor sanitation and hygiene issues. Behind me is some training in plumbing that's happening to ensure that environmental health workers are on the ground every day working with sanitation issues, hygiene issues, things that happen such as pests and dogs and control of those issues as well. Environmental health is a partnership that happens between Shire and the community and the health service to ensure that all of those public health messages are reaching the ground level where the results need to be, so that right into the community that people understand the linkage between good health and disease prevention with the environment that surrounds them in their house, and ensuring that that's clean and of an appropriate standard in terms of sanitation, as well as has a surrounding that is enjoyable and people want to stay at. That's also important for people's social and emotional well-being as well.
So what we're going to look at now is the drainage fittings on a house, and one of the good starting points is this pipe, which runs in this case up the wall and through the veranda and onto the roof space. It's called the vent, and it's a good idea to look for this first because it gives you a starting point. It's always between the first and the second fitting, and in this case it's 100mm running up the wall. What's the purpose of the vent? The vent is firstly to get rid of some smells that might be in the drainage layer and allows the smells to sort of work their way up and get dissipated in the atmosphere above the roof of the house so you don't smell them. And the second purpose is allowing particularly the toilets to flush properly. And when you press button A on the toilet, you get this large purge of water and solids heading down towards the pipe, and it's pushing against the air in front of it, and it's creating a vacuum behind it, and that makes it a little bit hard for that flushing action. And that's a fairly hard thing to describe, but probably the best way to illustrate it is with a couple of Coke bottles. So this one here is just a normal Coke, and if we unscrew the top and let it run, it sort of goes blip, 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 which it does empty, but it takes a while and it's a bit irregular. And the second Coke bottle, if I can get it all correctly, is got a hole cut in the top or drilled in the top. So if we take this top off this Coke bottle and let it run, it pours straight out. So that hole there is like this vent. This vent is allowing air to come in as the toilet flushes and allows that flushing action to happen nice and smooth. You want that flush to go woof. You don't want it sort of going blub, 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 because your toilet's going to block. And that's one of the purposes of the vent.
Training of Aboriginal health workers in environmental health is critical to the delivery. Having ownership at a grassroots level of environmental health issues, and there being key leaders in the community that take a strong stance on environmental health issues. It's fabulous to see this progress on the Ngaanyatjarra lands in a very clear partnership between the Shire, the community and the health service. The health service measures the outcomes by some of the activity that happens in clinics, and we know that the direct linkage between diseases and environmental health. That includes things that are fairly basic, such as diarrhea related to sanitation, but also some chronic diseases as well that are directly linked to the environment around you. Things like smoking and cleanliness in your environment.
A lot of the struggles is a motivation and getting people to understand that the concept of environmental health as a positive thing. It's got to be very carefully imprinted and educated to enable them to realise the results of it, because we simply are not a quick fix system. It's something that if you increase the sewage system, it could be years before you see the benefits, and understand that there's been no sickness in that family because their sewage has been fixed. So it's very difficult, very hard to educate, but with support of other bodies, I'm sure we can all focus and achieve our goals.
Okay, Conway, this cockroaches are what's called thigmotatic. They like to hide in cracks and crevices. So this gel here has got a really strong attractant. So what we can do is put this gel in a few dots and dabs in the cupboards. The cockroaches will come and have a feed.
Critical to sustainability of an environmental health program is actually having local workforce that drives this change, and it's so exciting to see the impact that these young environmental health workers will be having and are already having through the partnership between the Shire and the health service and the community. The board of the Ngaanyatjarra Health Service is very strongly behind this partnership and ensuring that sustainable impacts in environmental health are made.
Environmental health is a subject that's important to us all and all the community, and if we all take it up and listen to our health workers and our mentors and environmental field workers and our environmental health officers, our doctors, our nurses, our teachers, we can achieve and help to eliminate a lot of diseases that we're experiencing at this stage.